Ozempic is everywhere. And let's be honest, the conversations around it, they can feel incredibly confusing sometimes.
Yeah, totally overwhelming. So much noise.
Exactly. So today, on the deep dive, we're cutting through all that noise. We want to give you Ozempic in real talk, what it actually is, how it helps, and really importantly, how to navigate using it without all the trauma.
Right. It's about getting you clear, actionable insights, stuff you can actually use based on the latest research and, the guidelines.
Absolutely. Our mission for this deep dive is really to equip you with a solid understanding.
That's right. We'll cover its role in managing blood sugar, supporting weight goals. We'll tackle some common misconceptions, too.
Yeah, there are a lot of those floating around.
For sure. And we'll even walk you through the practical stuff, like how to actually inject it yourself, make it feel as straightforward as possible.
Good. And we're also going to arm you with strategies for managing those common side effects that, can pop up.
The ones people worry about.
Right. And we'll dig into the honest truth about weight loss plateaus, because those happen. And what happens if you decide to stop the medication? That's a big question, too.
Definitely. And, of course, we have to touch on that viral topic, microdosing Ozempic.
Oh, yeah. Can't ignore that one.
Yeah.
We'll separate the fact from the hype there. Give you the real story.
Okay, but before we dive into any of the specifics, just a quick but really essential disclaimer here.
Yes, please. Super important.
This deep dive, it's purely for educational purposes. It is absolutely not medical advice. Cannot be.
Right. We're not your doctors.
Exactly. Your own clinician, your doctor or nurse practitioner, they understand your unique health situation best. Always talk to them for any personal medical decisions.
Think of this as information to help you have a better conversation with your doctor.
Perfect way to put it. It's about being well-informed, not self-diagnosing or self-treating. Always defer to your healthcare provider.
Okay, disclaimer done. Let's unpack this. We hear the name Ozempic constantly, but at its core, what is it? What are we actually talking about?
Right. So at its core, Ozempic is simply the brand name for a medicine called Semaglutide. That's the actual drug.
Semaglutide. Oh.
And it belongs to a specific family or class of medications. They're known as glucagon-like peptide-1 agonists, or just GLP-1s for short.
GLP-1s.
Heard that term.
Yeah. And you can think of it simply as a helper, like a supportive ally for your body's own systems that regulate blood sugar and appetite.
A helper. I like that framing. It sounds less, aggressive than just drug.
Exactly. It works with your body's natural signals, not just completely overriding them.
Okay. So we hear Ozempic talked about a lot for weight loss. A lot. But what's its primary, official approved purpose? Especially for adults with type 2 diabetes, because that's where it started, right?
That's a great question. And yeah, it's a super common point of confusion.
Yeah.
So for adults who are living with type 2 diabetes, Ozempic has several key approved benefits. These are backed by big clinical trials.
Okay, what are they? First, and this is really its foundation, it helps in lowering blood sugar. That's its fundamental role, helping your body manage glucose, sugar, more effectively.
Right, better blood sugar control.
Yeah.
That's critical for type 2 diabetes.
Absolutely. But it's not just about blood sugar anymore, which is kind of amazing.
What else?
Well, this is where it gets really interesting, maybe even revolutionary for some folks. For people who have type 2 diabetes and already have established heart disease.
Yeah.
Ozempic acts like a shield in a way. It actively reduces the risk of major cardiovascular events. We're talking things like heart attack, stroke, or even death from cardiovascular causes.
Wow. Okay, that's way beyond just sugar control. That's protecting the heart itself.
Exactly. It transforms it from just a diabetes medication into a long-term protective agent for your heart if you fit that specific profile. And that finding came from large, really impactful clinical trials.
That is a game changer. Heart disease is such a huge risk with type 2 diabetes.
Huge. And it doesn't stop there. What about the kidneys?
Yeah, I was going to ask. I've heard whispers about kidney benefits, too. Is that official now?
It is indeed. And this is a newer but very important addition to its approved uses. For individuals with type 2 diabetes who also have chronic kidney disease, Ozempic is now approved to reduce the risk of their kidney function getting worse over time, basically. It helps reduce the progression to actual kidney failure, and it also helps reduce cardiovascular death in that group, too.
So heart and kidney protection for certain people with type 2 diabetes, that's really significant progress.
It really is. It offers this comprehensive protection across multiple vital organs for specific patient groups, way beyond just lowering A1C.
Okay, so Ozempic is semaglutide. that name again, but there's Wegovy. I keep hearing about that too. Are they related? Why two names if it's the same stuff?
An excellent question. Gets asked all the time. Yes, Wegovy is absolutely like a sister brand to Ozempic.
Sister brand, okay.
It's the exact same active medicine semaglutide. The difference is usually in the dosing and the primary approval. Wegovy is typically prescribed in different, often higher doses, and it's specifically approved for long-term weight management.
So Wegovy is the one officially labeled for weight management.
Right, for adults who have overweight or obesity. And interestingly, Wegovy also now carries an approval to reduce cardiovascular risk in adults who have existing cardiovascular disease and have overweight or obesity. That benefit was shown in another big outcome study.
So same medicine, semaglutide. But Ozempic is primarily for type 2 diabetes with those heart-kidney benefits for some, and Wegovy is primarily for weight management, also with a heart benefit for some.
You got it. Different brand names, different FDA-approved indications, often different dosing, but the core ingredient, semaglutide, is the same.
Okay, that clears things up a lot.
Yeah.
So then, if someone is talking about taking Ozempic specifically for weight loss and maybe they don't have type 2 diabetes, what's going on there? Is that, like, allowed or common?
Right, so that brings us to this concept of off-label use.
Off-label. Heard that too.
When a medication is used off-label, it just means it's being prescribed for a purpose that isn't explicitly listed on its official FDA label, or maybe for a patient group not specified on the label.
So using it for something it wasn't originally approved for.
Exactly. So yes, some people do use Ozempic off-label for weight loss, but it's really vital to stress any decision about off-label use. That's a very private, very individualized discussion. It should only happen between a clinician and their patient.
Makes sense. It's based on their specific situation.
Totally. Based on a thorough understanding of their health needs, the potential benefits, the potential risks. It's about a prescriber using their medical judgment, but it's not a formally approved indication for the Ozempic brand itself. That's Wegovy's lane, officially.
Got it. Okay, that distinction is super helpful. Now let's get into the mechanics. How does Ozempic actually work inside your body? People describe it, but it often gets really technical. Can we simplify it? Maybe using that thermostat analogy you mentioned.
Absolutely. The thermostat idea is a great way to picture it. Imagine your body has this internal thermostat for managing hunger and blood sugar. Sometimes, maybe with type 2 diabetes or other metabolic issues, that thermostat isn't quite calibrated right. You get highs, you get lows, maybe constant hunger signals.
Right. It's out of whack.
Exactly. Ozempic, as a weekly GLP-1 medication, acts like a helpful assistant to that thermostat. It subtly adjusts a few key dials to help bring things back into a healthier, more balanced range.
A finely tuned assistant, making small adjustments all week long. Okay, I like that. What are those specific adjustments? What dials is it turning?
Okay, so there are a few main things. First, when your blood sugar is high, like after you eat, Ozempic helps your pancreas release more insulin. Insulin is basically the key that unlocks your body's cells, letting sugar move from your blood into the cells to be used for energy.
So it helps your pancreas do its job better when sugar is up.
Precisely. It gives it a nudge. Second, it turns down glucagon.
Glucagon. What does that do?
Glucagon is a hormone that usually tells your liver to release stored sugar into your bloodstream. This happens between meals or overnight, and it can raise your blood sugar.
Okay. So Ozempic tells the liver, hey, hold on to that sugar for now.
Kind of, yeah. By reducing glucagon's signal, Ozempic helps keep your sugar levels from spiking too high when you haven't even eaten anything.
Okay, so that's two big actions on the blood sugar front. Releasing insulin, reducing glucagon.
Yeah.
What about the hunger side? Because that's what so many people are really curious about.
Right, and that's where the third and fourth actions come in, and these are often really key for the weight management effects people notice. Ozempic effectively slows the stomach a bit.
Slows the stomach. What does that mean exactly?
It means it slows down how quickly food physically leaves your stomach and moves into your intestines. This is called gastric emptying.
And why does slowing that down matter?
It's crucial because when your stomach empties more slowly, it sends signals to your brain saying, hey, we're still working on this food, we're full.
So you feel satisfied with less food.
Exactly. You feel full sooner, and that feeling of fullness lasts for a longer time after you eat. You're not looking for your next meal quite so quickly.
Okay, that makes total sense. Less food needed to feel satisfied, and it lasts longer. That seems like a huge factor for weight.
It's a major factor. And then there's the fourth action, which ties into this feeling too. It's what people often call food noise.
Food noise. I love that term. It sounds so relatable. What is it, and how does Ozempic affect it?
So food noise is that constant background chatter in your head about food. Thinking about your next meal, cravings, wondering if you should grab a snack. It can be really intrusive for some people.
Like a podcast playing in your head that you can't turn off, always talking about food?
Perfect analogy. Ozempic helps to quiet those snack thoughts or turn down the volume on that internal food podcast.
Oh.
Those constant nagging thoughts about food become less intense, less frequent. For some people, it's like their cravings just got ghosted. They fade into the background.
Cravings got ghosted. That's brilliant. It sounds like it could be really freeing for people who struggle with constant food thoughts.
It can be incredibly liberating. It allows people to think about food when they're actually hungry, rather than having it occupy their thoughts all day long.
So putting it all together, these 4 actions helps insulin, turns down glucagon, slows the stomach, quiets food noise. What's the overall effect? What do people typically experience?
Well, the combined outcome is often pretty profound. You'll likely see steadier blood sugar levels, fewer of those dramatic spikes and crashes after eating.
Smoother sailing on the blood sugar front.
Definitely. And because your stomach empties slower and that food noise is turned down, you naturally start eating smaller portions. You feel satisfied sooner with less food.
And that leads to?
And for many, this translates into gradual weight loss over time. Because you're consuming fewer calories, but importantly, you're doing it without feeling constantly deprived or fighting intense hunger pangs. Your body kind of settles into a new balance.
That makes so much sense. It's not forcing something unnatural. It's helping your body's own signals work more effectively, recalibrating, like you said.
Exactly. It's about working with your physiology.
Okay, let's focus back on blood sugar for a moment.
Yeah.
If someone starts Ozempic, mainly for type 2 diabetes, what can they realistically expect to see in their numbers?
Well, pretty early on, you might notice fewer really big after-meal blood sugar spikes. You know, that surge you might see on your meter an hour or 2 after eating, that tends to be blunted, much smoother.
Less of a roller coaster.
Right. And then over time, the big measure that reflects longer-term control is your A1C. You'd expect to see that improve.
A1C. Can you just quickly define that again for anyone who might be hearing it for the first time?
Sure thing. Your A1C, or hemoglobin A1C, gives you your average blood sugar level over the past 2 to 3 months. Think of it like a batting average for your blood sugar control, not just a snapshot from one moment.
So a lower A1C means better overall control over the long haul.
Exactly. Seeing that number come down is a really good sign that the medication, along with lifestyle changes, is working well.
Okay, fantastic. Now, Ozempic sounds like a really powerful tool, but it's not magic, right?
Yeah.
The basics of healthy living, they still matter. You can't just take the shot and eat whatever you want and expect great results.
Oh, absolutely not. That's a critical point. Ozempic is a tool, a very effective one for many, but it works best as part of a bigger picture.
The foundation still matters.
Totally. Foundational healthy habits are key. That means continuing to aim for regular meals, really prioritizing foods rich in protein and fiber. Those help with fullness and blood sugar too. Getting some daily movement, whatever that looks like for you, and getting good, consistent sleep. Sleep impacts hormones that regulate appetite and blood sugar too.
Right. So the medication supports the healthy habits, and the healthy habits support the medication.
Perfectly said. They work together synergistically. Those habits are the bedrock, and they'll significantly enhance Ozempic's benefits and just your overall well-being.
Good reminder. Okay, what about interactions? Many people with type 2 diabetes are on other medications already. How does Ozempic play with others, particularly other diabetes meds?
That's a super important consideration. If you are also using insulin or certain other oral diabetes pills that can cause low blood sugar, specifically a class called sulfonylureas. Like
glipizide or glyburide, those names.
Exactly, those common ones.
Yeah.
If you're on those with Ozempic, your prescriber will likely need to lower the dose of the insulin or the sulfonylurea.
Why is that?
Because Ozempic is already helping lower your blood sugar. Adding it to other meds that also strongly lower blood sugar increases the risk of going too low, having hypoglycemia, and that can be dangerous.
Okay, so it's a safety adjustment.
Absolutely, and this is crucial. Cannot stress this enough. Do not change any of your medication doses on your own, ever.
Don't decide, oh, I'll just cut my insulin in half.
Please don't. Always, always ask your clinician first. They need to make those adjustments carefully based on your specific situation and blood sugar readings. They'll guide you safely.
That is a firm Incredibly important warning.
Okay, let's shift gears slightly. Moving from blood sugar more towards that topic on everyone's mind. Weight loss. What should people realistically expect in terms of a timeline and body changes?
Okay, so in the early stages, often within the first few weeks, maybe even sooner for some, you'll likely notice that drop in appetite we talked about. And you might find yourself naturally eating smaller portions. That's often the first sign people notice if weight loss is a goal.
So appetite changes can kick in pretty fast.
Yeah, often relatively quickly. But, and this is important for setting expectations, the actual weight loss itself is typically gradual. It's usually not a sudden dramatic drop overnight. Think slow and steady.
Slow and steady. That's probably healthier anyway, right?
Generally, yes, and more sustainable. Now, about plateaus.
Yes, the dreaded plateau. People hit a point where the scale stops moving and they get really discouraged. They think, oh no, the medicine stopped working. Right, but plateaus are completely normal. They are a natural part of any weight loss journey, whether you're using medication or not. It absolutely does not mean the medicine has stopped working.
So what is happening during a plateau?
Your body is smart. It's adjusting to its new, lower weight. Your metabolism might be recalibrating. Think of it like your body taking a pause to catch up and establish a new set point before it might be ready to continue losing, if that's appropriate.
So don't panic if you hit one.
Don't panic. Trust the process. Talk to your healthcare team. Sometimes small tweaks to diet or exercise can help, but often it's just a matter of patience and consistency. Progress isn't always linear.
That's really comforting to hear and so important for people to understand. Okay, sticking with body changes, there's been a lot of chatter, especially online, about Ozempic face. What is that, and can you actually do anything about it?
Yeah, Ozempic face. It's a term people use to describe a look that can sometimes happen with significant or rapid weight loss. The face looking a bit drawn or gaunt, maybe more wrinkles seem apparent.
Why does that happen?
Well, when you lose weight, you lose fat from all of your body, including your face. We have fat pads in our cheeks and under our eyes that contribute to a fuller, more youthful look. Losing that fat can make the skin seem looser or features look sharper.
Okay, so it's a consequence of losing facial fat. Can you minimize it? Because nobody really wants that drawn look.
You can definitely take steps to minimize it and, importantly, protect your overall body composition. The key is preserving muscle mass while you lose fat.
Muscle mass.
Yeah.
How does that help your face?
Well, maintaining muscle mass helps keep your metabolism healthier, which supports more gradual, sustainable weight loss. And generally, having good muscle tone contributes to a healthier overall appearance, less of that wasting away look. Plus, focusing on muscle helps ensure you're primarily losing fat, not precious muscle tissue.
Okay, so how do you protect muscle while losing weight on Ozempic?
Two main things. First, protein, protein, protein. Aim for adequate protein at each meal. Protein is the building block for muscle, and getting enough helps your body hold on to muscle even when you're in a calorie deficit.
So prioritize chicken, fish, beans, tofu, Greek yogurt, that kind of stuff.
Exactly. Make it a consistent focus. Second, incorporate 2 to 3 short strength training sessions a week.
Strength training? Does that mean I have to become a bodybuilder?
Not at all. We're not talking hours in the gym lifting super heavy weights unless you want to. Simple things count. Bodyweight exercises like squats, lunges, push-ups, even modified against a wall or counter, using resistance bands, lifting light dumbbells, or even water bottles or soup cans.
So just challenging your muscles a bit, a few times a week.
That's the idea. Stimulate the muscle, tell your body you still need it. It makes a big difference in preserving muscle mass and can absolutely help you achieve a healthier look during weight loss, minimizing that drawn appearance.
That's really practical advice. Protein plus some simple strength moves.
And it all ties back to that idea of slower, steadier weight loss, generally being more maintainable and less of a shock to your system. It gives your skin more time to adjust too.
Makes sense. Okay, let's talk about actually using the medication, the dosing journey. I hear that phrase, start low, go slow, all the time. Why is that the approach?
Start low, go slow is absolutely the mantra for starting Ozempic, and for good reason. Most people begin on a very low dose, the lowest available, and then they gradually increase it, usually about once a month.
Stepping up month by month.
Right. Provided they're tolerating the current dose well, meaning minimal side effects. This gradual increase process is called titration, and it's really designed with your comfort and safety in mind.
Okay, can you walk us through the typical schedule? What does start low actually mean in milligrams?
Sure. The standard starting dose is 0.25 milligrams injected once a week for the first 4 weeks. It's really just an introductory dose to let your body get used to the medication.
0.25 milligrams for a month? Then what?
After those 4 weeks, assuming you're doing okay with it, the dose usually goes up to 0.5 milligrams once weekly. You'd typically stay on that for at least another 4 weeks.
Okay, 0.5 milligrams for the second month, roughly.
Right. Then, if you and your doctor decide you need more blood sugar control or perhaps more effect for weight management, and you're tolerating the 0.5 milligram a dose well, you might increase to 1.0 milligrams once weekly.
And is that the top dose?
There's one higher dose available, 2.0 milligrams once weekly, but that's typically reserved for situations where the lower doses haven't quite gotten you to your specific blood sugar or cardiovascular risk reduction goals, and again, only if prescribed and tolerated. It's a very structured, step-by-step process.
And why? Why go through all these steps instead of just starting at the dose that's likely to work?
It really comes down to managing side effects.
The comfort kit stuff we talked about.
Exactly. The most common side effects, especially things like nausea, maybe some burping, changes in bowel habits, they are much more likely to happen or be more intense if you start on a higher dose right away.
So going slow gives your body time to adapt.
Precisely. Your digestive system, your brain signals, they all get a chance to adjust more gently. This significantly reduces the chance of feeling really unwell, which makes it much more likely you'll stick with the medication and get the benefits. It's about finding that balance effectiveness without misery.
Makes perfect sense.
Yeah.
Nobody wants to feel awful starting a new med. Okay, practical question. What if someone misses a dose? Life happens. Do you take it late? Skip it? What's the rule?
Good question. There's a clear guideline. If you forget your weekly dose, you should take it as soon as you remember, as long as it's within 5 days of your scheduled dose day.
So you have a 5-day grace period, basically.
Pretty much. Let's say you take it Sunday and you forget. You can take it Monday, Tuesday, Wednesday, Thursday, or Friday.
Okay. But what if it's been longer than 5 days? Like you remember on Saturday and your dose day was Sunday.
If more than 5 days have passed since your missed dose was due, then the advice is to skip that missed dose entirely.
Just forget about it for that week.
Yep. Just wait and take your next dose on your usual, regularly scheduled day. Don't double up or take 2 doses close together.
Got it. Within 5 days, take it. More than 5 days, skip it and wait for the next scheduled one.
Exactly. And, as always, the golden rule. Follow your prescriber's specific instructions first. They might have slightly different advice based on your individual health, so always check with them if you're unsure.
Always check with the doc. Good advice. Okay, now, the injection itself. For many people, the idea of giving themselves a shot can be, a bit intimidating, especially the first time.
Totally understandable. It's a new skill for most people.
Can you walk us through it? Like you're coaching a friend who's nervous? Keep it simple.
Absolutely. Let's break it down step by step. Think of it as just a few simple actions. First, preparation.
Okay, prep. What's involved?
You need to pick your injection spot. The common areas are your belly, abdomen, your thigh, or the back of your upper arm. Choose one of those spots.
Does it matter where exactly on the belly or thigh?
On the belly, stay at least a couple of inches away from your belly button. On the thigh, the front or outer part is good. Back of the upper arm works too, but might be easier if someone helps you reach. Once you've picked the spot for this week, clean the skin well with an alcohol swab and let it air dry completely. Don't blow on it.
Clean and dry. Got it. What else for prep?
This is critical. Always use a brand new needle for every single injection. Never, ever reuse a needle. They get dull, it hurts more, and it's an infection risk. The Ozempic pen comes with needles, or you get them prescribed separately. Use a new one each time.
New needle every time. Crystal clear. What about if it's a brand new pen just out of the box? Is there anything special you do the very first time?
Yes, good point. For a new pen that you're using for the very first time ever, you'll usually need to do a quick flow check or prime it. Your pharmacist or nurse probably showed you this.
What does that involve?
You'll attach a new needle, then turn the dose selector usually to a specific flow check symbol shown in the instructions. You hold the pen with the needle pointing up and press the injection button until you see a tiny drop of liquid appear at the needle tip.
Why do you do that?
It just makes sure the pen and needle are working correctly and gets rid of any air bubbles before your first real dose. You only do this the very first time you use each new pen.
Okay, flow check done for a new pen. Spot is clean and dry. New needle is on. What's next for the actual injection?
All right, now for the main event, which is actually really quick. First, dial your dose. Turn the dose selector knob on the pen until your prescribed dose number lines up clearly in the dose window. You'll hear clicks as you turn it.
So if my dose is 0.5, I turn it until 0.5 shows in the window.
Exactly. Double check it's the right number. Second, gently but firmly press the pen against your clean skin at the spot you chose. Don't pinch the skin unless your provider told you to. Just press the needle straight in.
Okay, pen against skin. Then.
Third, push the injection button all the way down and hold it down. You'll likely hear it clicking or feel it depress. Keep holding it.
How do I know when the medicine is all in?
While you're holding the button down, watch the dose counter in the window. It will slowly move down and return to 0.
Okay, wait until it hits 0.
Yes, but don't pull the pen away immediately when it hits 0. This is a super important tip.
Oh, what do you?
After the counter shows 0, keep the pen pressed against your skin and count slowly to 6. 1, 1,000, 2, 1,000, all the way to 6.
Count to 6 after it hits 0.
Why? It ensures that the full dose of medication has time to flow out of the pen and into your body before you remove the needle. It prevents medication from leaking back out so you get your complete dose. That 6-second count is key.
Hold and count to 6. Got it. That's a great specific tip. Then you can pull the needle out.
Then you pull the needle straight out. You might see a tiny drop of blood. That's normal. You can press gently with a cotton ball if needed, but usually no bandage is required.
Okay. And what do you do with the needle now?
Immediately and carefully remove the used needle from the pen. Don't recap it with the original big cap usually. Often there's an outer cap you can use to unscrew it safely. Then dispose of the used needle right away into a designated sharps container, not the regular trash.
Sharps container. Very important for safety. What about the pen itself?
Put the pen cap back on the pen and store it according to the instructions until your next dose.
And you mentioned choosing a spot. Should I use the same spot every week?
No, it's really important to rotate your injection spots. If you used your belly this week, maybe use your thigh next week, or the other side of your belly, or your arm.
Why rotate?
It helps prevent irritation, skin thickening, or lumps from forming at any one site, keeps the skin healthy, and helps the medication absorb consistently. Just move it around within those recommended areas.
Rotate spots. Makes sense. Okay, let's talk storage again quickly before I use the pen the first time.
Before first use, keep the Ozempic pen in the refrigerator. But critically, do not freeze it. Freezing can ruin the medication.
Fridge, not freezer.
Got it. What about after I've used it once? Does it have to go back in the fridge?
After the first use, you actually have a choice. You can continue to store it in the fridge, or you can keep it at room temperature, as long as the room stays below 86 degrees Fahrenheit, 30 Celsius.
Oh, that's convenient. So I don't have to keep it cold all the time after I start it.
Nope. Room temperature is fine, which is handy if you're traveling or just for convenience. Just make sure you always protect it from direct heat and sunlight wherever you store it. Keep the cap on.
Good to know. Any other storage rules, like about leaving the needle on?
Yes. Absolute critical rule. Do not store the pen with a needle attached. Always remove the needle immediately after your injection before storing the pen.
Why is that so important?
Leaving the needle on can allow air to get into the pen cartridge or medication to leak out. It can also lead to the needle getting clogged. Always take the needle off right away.
Remove needle immediately.
Right.
Got it. And how long is the pen good for once I start using it? Does it expire? Yes. Once you take that first dose from a pen, you need to use up that pen within 56 days. That's 8 weeks.
56 days. Even if there's still medicine left in it after 56 days?
Even if there's medicine left. After 56 days from the first use, the stability and potency of the medication can't be guaranteed, so you need to safely discard the pen and start a new one. Mark the date you first used it on the pen or your calendar.
56-day limit after first use.
Okay.
And final safety wrap-up on pens and needles, the absolute must-dos or must-don'ts.
The big ones. Never, ever share your Ozempic pen with another person, even if you change the needle. That's a serious infection risk, could transmit bloodborne diseases. Your pen is for you only.
Never share pens. Got it.
And as we said, never reuse needles. One injection, one needle, period. Dispose of used needles safely in a sharps container immediately. These aren't suggestions. They're essential for your safety and the safety of others.
Never share pens, never reuse needles, dispose of sharps safely. Got it loud and clear. Thank you for walking through all that practical injection and storage stuff. It feels much less mysterious now.
Glad to help. It becomes routine pretty quickly for most people.
Okay, let's talk side effects. Because let's be real, most medications have them, and it's good to be prepared. What are the common things people might experience with Ozempic? And what can they do? This is building that comfort kit, right?
Exactly. Having a comfort kit of strategies is key. The most common side effects are usually related to the digestive system. Think nausea, some burping, maybe constipation or diarrhea, and often a feeling of being very full, sometimes uncomfortably full, even after eating just a small amount.
Okay, nausea, fullness, maybe bathroom changes. When do those usually show up?
They're typically most noticeable when you first start the medication or right after your dose increases. That's when your body is doing the most adjusting to the effects, especially that slowed stomach emptying.
Makes sense. So what's in the comfort kit for dealing with nausea and that maybe unpleasant feeling of fullness?
For nausea and feeling too full, the number one strategy is to eat smaller meals more frequently rather than 3 large ones. And chew your food really well and slowly. Listen to your body's fullness cues when you start to feel satisfied. Stop eating. Don't try to push through and finish everything on the plate if you're full.
Smaller meals, slow down, stop when full. Sounds simple, but probably effective. What about what you eat?
Yes, that matters too. Try to eat protein first at your meals. Chicken, fish, beans, eggs, then your non-starchy vegetables. And especially when you're starting out or just increased your dose, try to be gentle with really heavy, greasy, or high-fat foods.
Like fried foods or super creamy sauces?
Exactly. Those can sit heavily in a slower-moving stomach and definitely make nausea or discomfort worse while your body is adapting. Lighter foods are often better tolerated initially.
Good tip. What about drinks? I heard fizzy drinks might cause issues.
Yes, that's true for some people. Skipping carbonated drinks like soda or sparkling water, especially early on, might help reduce feelings of bloating, gas, or burping, which can happen with the slow digestion.
So maybe stick to plain water.
Plain water is your best friend. Sip water consistently throughout the day. Staying well hydrated is so important. It helps with digestion, it can sometimes help with nausea, and it's crucial for preventing constipation. Don't wait until you feel thirsty, just keep sipping.
Hydrate, hydrate, hydrate. Got it. Now, you mentioned constipation as a possibility. That sounds like it could get uncomfortable if it goes on too long. What's the plan for that?
For constipation, which can definitely happen with slow digestion, the key is being proactive. First line of defense, increase both your fluid intake, more water, and your dietary fiber.
Fiber firm.
Fruits, vegetables, whole grains like oatmeal or brown rice, beans, lentils, nuts, seeds. Gradually increase your fiber intake, though. Don't suddenly add a ton, as that can cause gas, too.
More water, more fiber. What if that's not enough?
If constipation becomes a persistent problem despite increasing fluids and fiber, definitely talk to your clinician or pharmacist. Don't just suffer through it. They can recommend safe and appropriate over-the-counter options like a gentle laxative or stool softener if needed, but always ask first.
Ask before taking anything else. Got it. Are there any simple lifestyle things that can help with digestion or overall comfort on Ozempic?
Yes. A really simple but effective one is taking a gentle walk after meals.
Just a short walk.
Doesn't have to be long or fast. Even just 10 or 15 minutes of gentle movement after eating can help stimulate digestion, potentially ease feelings of fullness or bloating, and it's good for blood sugar too.
Nice. Little post-meal stroll. Easy enough to try. Okay, so that's the comfort kit for the common, usually manageable stuff. What about less common but more serious symptoms? When should someone really pay attention and actually call their doctor or seek care? This is where listening to your body is critical, isn't it?
Precisely. This is about recognizing potential warning signs that need prompt medical attention. You should seek care right away if you develop severe belly pain, especially if it's intense pain in your upper abdomen, maybe radiating to your back, or severe pain on your right side under your ribs.
What could that severe pain mean?
It could potentially be a sign of pancreatitis, inflammation of the pancreas, or gallbladder problems like gallstones, both of which are rare but serious possible side effects that need immediate evaluation.
Okay, severe belly pain, seek care immediately. What else?
Also, if you have repeated vomiting that you can't keep fluids down, or vomiting that just doesn't stop, that needs attention to prevent dehydration and figure out the cause.
Makes sense. What about those low blood sugar issues we mentioned earlier if someone is also on insulin or a sulfonylurea?
Yes. If you're on those other meds, be vigilant for signs of low blood sugar. Hypoglycemia. That might feel like shakiness, sweating, sudden confusion, dizziness, rapid heartbeat, or intense hunger. If you experience those, treat the low blood sugar as you've been taught, usually with fast-acting sugar, and then definitely report it to your clinician, as your other medication doses might need further adjustment.
Okay. Treat the low, then tell the doc. What about vision?
Any vision changes, blurry vision, worsening vision, should be reported to your clinician promptly, especially if you have a history of diabetic eye disease, retinopathy, as rapid blood sugar improvement can sometimes temporarily affect it. They need to check it out.
Vision changes, report them. Gallbladder symptoms. You mentioned right side pain, but anything else?
Other potential gallbladder symptoms besides that right upper belly pain could include fever or jaundice, which is yellowing of the skin or eyes. If you notice those, seek care.
Got it. And dehydration. You mentioned vomiting could cause it.
Yes, dehydration can be a risk, especially if you have significant nausea, vomiting, or diarrhea. Severe dehydration can put stress on your kidneys, which is particularly important if you already have kidney issues. So keeping up with fluids is crucial, especially if you're losing fluids through vomiting or diarrhea. Tell your doctor if you're struggling to stay hydrated.
Okay. So severe pain, repeated vomiting, signs of low sugar, if applicable, vision changes, gallbladder symptoms, dehydration concerns. Those are all call your clinician or seek care situations.
Yeah.
What about pregnancy?
Absolutely critical. If there's any chance you might be pregnant, or if you become pregnant while taking Ozempic, you need to tell your clinician immediately.
And usually they stop the medication if someone is planning a pregnancy, right?
Yes. A quick heads up on that. Because the drug stays in your system for a while, prescribers will typically advise stopping Ozempic at least 2 months before you plan to try to conceive. This is because the effects on a developing baby haven't been adequately studied. So family planning is an important conversation to have with your doctor beforehand.
2 months before trying. Good to know. And what if a side effect isn't on this serious list, but it's just really bothering someone? Like maybe mild nausea that just won't quit and makes them miserable. Is it okay to call about that too?
Absolutely. Yes, please do. Don't ever hesitate to contact your clinician if any side effect is worrying you or significantly impacting your quality of life, even if it seems mild on paper. Your comfort and ability to tolerate the medication matter. They are there to help you troubleshoot, adjust things if needed, or just offer reassurance. Don't suffer in silence.
That's great advice. Okay, now, integrating that clinician guest perspective we talked about. Let's say we brought in a friendly clinician right now to give us the absolute must-know safety pointers.
Precisely. And this raises that key question. Knowing when to reach out for professional guidance is paramount. It's fascinating, really, recognizing the signals your body might be sending and knowing how to respond.
So summarizing those key signals, again, call your clinician if you have.
Severe belly pain, upper abdomen right side especially, repeated vomiting, signs of low blood sugar, if you're on insulin sulfonylureas, vision changes, possible pregnancy, or truly, if any side effect worries you.
Got it. And beyond those immediate symptoms, what about proactive communication, things you need to tell your doctors before something happens?
Great point. Think ahead. A crucial practical tip. If you are scheduled for any procedure that involves anesthesia or deep sedation, think surgery, or an endoscopy like a colonoscopy, you absolutely must tell your surgical team or the endoscopy team that you take Ozempic well in advance.
Why is that so important?
Remember how Ozempic slows down stomach emptying? That means food can stay in your stomach longer than usual. During anesthesia or deep sedation, there's a small risk of stomach contents coming back up and getting into your lungs that's called aspiration, and it can be very serious.
Oh, okay. So they need to know your stomach might not be empty even if you follow the usual fasting rules.
Exactly. They might need to adjust your fasting instructions or take other precautions. So giving them a heads up that you're on Ozempic or any GLP-1 is essential for your safety during the procedure. Don't assume they'll know. Tell them explicitly.
Crucial safety tip. Always be upfront with all your doctors about all your medications.
Always. Your clinician knows your overall health best, but they need all the pieces of the puzzle.
And one final, very specific but critical warning that appears in the medication guide.
Yes, there's a very important warning regarding thyroid cancer. Do not use Ozempic if you have a personal history or if a family member has ever had a specific type of thyroid cancer called medullary thyroid carcinoma, MTC.
MTC. Wow.
Or if you have a rare condition called multiple endocrine neoplasia syndrome type 2, MEN2, which increases the risk of MTC. This is based on studies in rodents. The risk in humans isn't fully known, but it's taken very seriously.
So personal or family history of MTC or MEN2 means Ozempic is not the right choice.
Correct. It's what's called a contraindication. Your prescriber will ask you about this history before starting the medication. It's a rare situation, but a vital safety check.
Okay, wow. That covers a lot of the critical safety ground.
Yeah.
Now, switching gears slightly again, but still related to safety, getting the actual medication safely. There's so much talk about shortages and online sellers.
Yes, navigating the market right now is tricky, and being careful is paramount. Rule number 1. Insist on using only FDA-approved Ozempic that comes directly from a licensed U.S. pharmacy, period.
Licensed U.S. pharmacy. Not some random website or someone on social media?
Absolutely not. Strongly warn against buying any prescription medication, especially injectables, from social media sellers, overseas websites, or any source you can't absolutely verify is legitimate and licensed in the U.S. The risks are enormous.
What are the risks? Getting fake stuff.
Fake stuff, contaminated products, medication that's expired or wasn't stored properly so it doesn't work, getting the wrong dose, getting something completely different and potentially dangerous. The list goes on. It's just not worth the risk to your health or your wallet.
How can you try to tell if it's legitimate?
Look for professional, consistent packaging. It should have clear lot numbers, expiration dates. The pen itself should look exactly like the ones shown by your pharmacist or doctor. If the packaging looks tampered with, if the price seems unbelievably low, if the seller asks for payment in weird ways like gift cards, those are huge red flags. Trust your gut. If it feels sketchy, it probably is.
Stick to your regular licensed pharmacy.
It's the safest way. They have regulated supply chains and quality controls.
And just to hammer home those core safety points one more time.
Never share pens. Your pen is yours alone. Never reuse needles. One shot, one needle. And remember to store your pen correctly away from extreme heat, direct sunlight, and never with a needle attached.
Got it. Now, cost. It's a huge issue for so many people with these medications. They can be really expensive. What can listeners do if the price tag is a major barrier?
Yeah, cost is a real challenge. Don't assume you're out of options, though. First, ask your clinician or pharmacist about potential patient assistance programs. The manufacturer often has programs for eligible individuals who can't afford the medication.
Okay, manufacturer assistance programs. What else?
Talk to your insurance company. Understand the steps required for coverage. Sometimes it's a prior authorization form your doctor needs to fill out. Understand your copay. Also, ask your doctor if there are other, perhaps more affordable GLP-1 medications or other diabetes weight management treatments that might be appropriate for you and better covered by your plan.
So explore all the options with the doctor and pharmacist.
Absolutely. They are your best allies in navigating the often confusing world of insurance and medication costs. They might know about specific programs or alternatives.
Okay. Now, a word about compounded semaglutide. We hear about compounding pharmacies making versions of these drugs, sometimes cheaper. What's the deal with those? Are they safe?
This is a really important area where extreme caution is needed. Compounded medications are made by specific pharmacies that mix ingredients themselves. While compounding has legitimate roles, there are significant concerns specifically around compounded semaglutide right now.
What are the concerns?
The FDA has issued warnings. Some compounded versions have been found to use unapproved forms of semaglutide, like different salt forms, that haven't been proven safe or effective in people.
So not the exact same stuff as an Ozempic or Wegovy?
Potentially not. And critically, there's a high risk of inaccurate dosing with compounded products. They might contain less active ingredient than claimed, or sometimes even more, leading to unpredictable results or side effects. Quality control can be inconsistent compared to FDA-approved manufactured drugs.
That sounds risky, not knowing exactly what you're getting or how much.
It's a very significant risk. While some compounding is necessary and legal, particularly during shortages, you need to be incredibly careful. Always discuss it thoroughly with your prescriber. Ask them and your pharmacist tough questions about the source of the active ingredient, the pharmacy's reputation, and whether it's truly necessary versus using an FDA-approved product, even if that means exploring different options or assistance programs. Your safety has to come first.
Be very, very cautious with compounded versions. Ask lots of questions. Okay, that's a lot of crucial safety and access information. Let's zoom out again briefly. We touched on the bigger picture benefits earlier, heart and kidney health. Can we just revisit those quickly? Because they're pretty remarkable.
Yeah, they really are. And it's worth emphasizing because it shifts the view of Ozempic beyond just sugar or weight. For adults who have type 2 diabetes and already have established cardiovascular disease.
Like that specific group.
For them, Ozempic has been proven in large, rigorous clinical trials to significantly reduce the risk of major cardiovascular events. We're talking heart attack, stroke, cardiovascular death. It's an active protective effect on the heart and blood vessels.
That's incredible. A diabetes drug that also protects the heart in high-risk people.
It's a huge advancement. And similarly for adults with type 2 diabetes and chronic kidney disease.
The kidney benefit.
It now has that official indication to reduce the risk of kidney function getting worse over time, reduce the progression to kidney failure, and also reduce cardiovascular death in that population. So it's protecting kidneys too.
Wow. Offering multi-organ protection for certain patient groups. That really changes the landscape of treatment, doesn't it?
It absolutely does. It highlights that managing type 2 diabetes effectively is about more than just the A1C number. It's about protecting the whole body long term.
But again, just to be clear, these specific heart and kidney risk reduction benefits depend on the individual, right? It's not guaranteed for everyone who takes Ozempic.
Yeah, precisely. The exact benefit for you depends entirely on your specific health history, whether you have type 2 diabetes, established heart disease, chronic kidney disease, and your overall treatment plan. Your clinician is the only one who can tell you if these specific protective benefits apply to your situation based on the clinical trial evidence and your personal health profile.
Always comes back to that personalized conversation with your doctor.
Always.
Okay, let's tackle that other hot topic we mentioned, microdosing Ozempic. It's all over TikTok, blogs. What exactly is it people are talking about?
Right, microdosing. It's a catchy term, but it usually means one of two things people are trying. Either taking tiny doses more often than once a week, like splitting a weekly dose into multiple smaller shots, or staying on the very lowest doses, like 0.25 milligram, for much longer than the standard titration schedule recommends.
So deviating from the once weekly stepped-up dosing plan.
Exactly. And it's crucial to understand right off the bat. This is strictly off-label use. It is not how the medication was studied. It's not how the instructions are written. It's not the FDA-approved way to use it.
Off-label. Got it. Why are people trying it then? What's the appeal? What are they hoping to achieve?
Usually the motivations are things like trying to get fewer side effects, hoping that smaller, more frequent doses might be gentler on the system. Sometimes it's an attempt to stretch the cost of an expensive medication, making one pen last longer. Or some people might try a very tiny dose for long-term maintenance after they've already lost weight, thinking they only need a little bit to keep the effects going.
Okay, those are understandable goals.
Yeah.
But does it work? And does the way the medicine is designed matter here? You said it lasts about a week in the body.
That's the key point. Ozempic is designed for once-weekly dosing precisely because it has a long half-life. It stays active in your body for about a week. That's why the weekly injection schedule works. It maintains a relatively steady level of the drug in your system throughout the week.
So messing with that schedule, taking smaller bits more often, changes that steady level.
It absolutely changes the pharmacokinetics, the drug levels in your body, and frankly, we don't have good data on what the implications of that are, whether it's less effective, more effective, or has different safety issues.
So what do we know from actual studies? Is there any evidence that microdosing is better or safer than the standard weekly plan?
Bottom line, there are no strong clinical trials that show microdosing Ozempic or splitting doses works better or is safer than the standard approved once-weekly dosing schedule. Full stop.
No proof it's better.
No proof. Now, anecdotally, you might hear stories, and sometimes a clinician might, in a very specific case for someone extremely sensitive to side effects, try an ultra-slow titration under very close supervision. But that's a specific medical decision, clinician directed. It's not something people should be experimenting with on their own based on internet trends.
Right. What are the actual risks involved if someone tries this, maybe getting doses from one of those questionable compounded sources?
There are significant risks. First, trying to accurately measure tiny, non-standard doses from a pen designed to deliver specific increments like 0.25, 0.5, 1.0 milligrams is really difficult. There's a high potential for dose errors getting too little or maybe even too much. The pens just aren't made for that kind of precise micro-measurement.
Inconsistent dosing. Yeah, that sounds bad.
Very inconsistent. Second, as we discussed with compounding, there are major quality concerns if people are getting purported microdoses from unreliable sources. You risk getting unapproved ingredients, contaminated products, or wildly inaccurate doses. It's a huge gamble with your health.
So the final verdict on microdosing Ozempic is?
It's an interesting idea floating around, but it's not proven and carries real risks. For the vast majority of people, the safest and most effective approach is to stick with the slow and steady weekly titration schedule that's been studied and approved. Work with your clinician, manage side effects with the strategies we discussed, focus on healthy lifestyle habits. That's the evidence-based path.
Stick to the script, basically, the one that's been tested.
Exactly. Don't let social media trends override proven medical protocols when it comes to prescription medication.
Excellent clarification. Thank you. Okay, let's talk about just daily life. You're on Ozempic, things are going okay. What should you be eating day to day? Any simple guidelines?
Yeah, keeping meals relatively simple and balanced is usually a good strategy. Think about building your plate. Aim for a good source of lean protein. Chicken, fish, beans, tofu, eggs. Plenty of non-starchy vegetables, leafy greens, broccoli, peppers, maybe a portion of a whole grain like quinoa or brown rice, or some beans, lentils, and a source of healthy fat like avocado, nuts, olive oil.
So a balanced plate. Protein, veggies, maybe some whole grains, beans, healthy fat.
That combination tends to provide good satiety, stable energy, and lots of nutrients without being overly heavy, which, as we said, can help manage potential digestive side effects.
And still being mindful of those really heavy, greasy meals, especially at first.
Definitely. Ease into those. Your tolerance might improve over time, but especially when starting or after a dose increase, lighter preparations are often more comfortable.
What about snacks? If you do get hungry between meals, what are some smart choices?
Great question. Simple, protein-focused snacks are often ideal because they're satisfying and help you meet your protein goals. Things like a hard-boiled egg, a small handful of nuts, plain Greek yogurt or cottage cheese, maybe with a few berries, some beef or turkey jerky, or even hummus with veggie sticks like carrots or celery.
Easy, protein-packed options.
Exactly. They keep you full without derailing your efforts.
Hydration. We keep coming back to it, but it's clearly important.
Cannot emphasize it enough. Hydrate steadily. Sip water throughout the day. Keep a water bottle handy. It helps everything function better, aids digestion, prevents constipation, helps manage fullness. It's foundational.
Got it. Drink water. What about movement? We talked about strength training, but what about just general activity?
As we mentioned, that light movement after meals, like a short walk, can be really helpful for digestion and blood sugar. But just incorporating regular movement throughout your day in general is great. Taking the stairs, parking further away, finding activities you enjoy, it all adds up.
And aiming for those 2 to 3 short strength sessions a week to protect that muscle mass.
Yes, keep that muscle strong. It's so important for metabolism and overall health, especially during weight loss.
Okay, fantastic. We've covered so much ground, but people always have specific questions. Let's do a quick rapid fire round on some of the top FAQs we hear. Ready?
Let's do it.
Q1. How fast will I actually see results? Appetite versus blood sugar versus weight.
A, appetite changes, that food noise quieting, that can show up really fast, sometimes within days or the first couple of weeks. Blood sugar improvements, especially your A1C, build more gradually over months. Weight loss is also typically gradual, unfolding over weeks and months.
Okay. Q2. Can I drink alcohol on Ozempic?
A, generally moderation is key, but be aware. Alcohol can increase the risk of low blood sugar, especially if you also take insulin or sulfonylureas. And for some people, it might worsen nausea. So proceed cautiously, know how it affects you, and definitely talk to your doctor if you take other diabetes meds.
Got it. Q3. What about prediabetes or PCOS, polycystic ovary syndrome? Can Ozempic help with those?
A, sometimes Ozempic or other GLP-1s are used off-label for these conditions, often focusing on weight management or improving insulin resistance, which can be factors in both. But again, it's off-label. You absolutely need to have a detailed discussion with your clinician about the specific risks and benefits for you. It's not an automatic yes.
Okay. Q4. Quick recap. What should I eat on Ozempic?
A, smaller meals are often better. Focus on protein first, then load up on veggies. Go easy on greasy or super heavy foods, especially initially, and hydrate consistently.
Perfect. Q5. Can I take Ozempic with other common diabetes meds like metformin or insulin?
Yes, often they are used together. Metformin usually doesn't require a dose change, but as we stressed, if you take insulin or sulfonylureas, those doses might need to be lowered to prevent low blood sugar. Never adjust on your own, always guided by your clinician.
Critical reminder. Q6. Ozempic phase. Can I prevent it?
A, you can definitely minimize the risk. Avoid super rapid weight loss, the key strategies. Get enough protein consistently and incorporate strength training 2 to 3 times a week to preserve muscle mass.
Protein and strength training. Got it. Q7. What is microdosing Ozempic and is it safe?
A, it means taking tiny doses or splitting weekly doses. It's off-label. There's no proof it's better or safer than the standard once-weekly dosing. It carries risks of dose errors and issues with compounded products. Only consider it under strict clinician guidance, if at all. Sticking to the approved method is generally best.
Right. Q8, the big one. What happens if I stop Ozempic? Will I regain the weight?
A, it's highly likely, unfortunately. Appetite often returns to your pre-medication baseline, and weight regain is common if you stop the medication without a solid maintenance plan in place. It's crucial to plan for maintenance with your care team before stopping. Discuss sustainable lifestyle habits and maybe other long-term strategies. It's not usually a cure you can just stop.
Plan for the long term. Okay, that was a great rapid-fire round. You're listening to The Deep Dive.
This has been a really thorough walkthrough, covering so much.
Yeah, just to quickly recap the big takeaways, Ozempic can be a really effective tool for many people managing blood sugar and supporting weight management goals.
And while those side effects are common, especially at first, they are often very manageable. Remember the keys. A slow start with dosing, making smart food choices, smaller meals, protein first, easy on grease, and steady hydration.
Absolutely. And one final time, that crucial reminder.
Right. This deep dive, everything we've discussed, was for educational purposes only. It is not and cannot substitute for personalized medical advice. Your own clinician knows your health best. Always, always consult them for decisions about your health and treatment.
Couldn't have said it better myself. If this deep dive helped you get a clearer picture of Ozempic, maybe demystified it a bit, please consider tapping that like button wherever you're listening or watching. It really helps us know what kind of information is valuable to you.
And if you know someone who's just starting Ozempic or maybe feeling confused or overwhelmed by all the information out there,
please share this deep dive with them. Maybe it can help answer some of their questions and ease their concerns.
And hey, what questions do you still have? Drop your top question about Ozempic or maybe another health topic you want us to tackle in the comments below. We might feature it in a future deep dive.
We love hearing from you. Thank you so much for joining us today. Here's to being well-informed, feeling empowered, and taking proactive steps on your health journey.
Take care, everyone.